Okay, on to allergy and immunology. Uh, and the Fibromyalgia Association does mention allergy, and maybe a prime example of this is like someone gets rid of wheat in their diet and gets rid of the inflammation and begins to feel better. God bless them. I don't know if that's an allergy or what, but God bless them for doing well for themselves. And also included is multiple chemical sensitivity. You know, you, and this could be just in environmental issues. Mold in the home could be a problem, or the formaldehyde coming off new carpeting could be a problem, making you feel lousy. And God bless again anybody who gets, down to the bottom of that type of issue that can improve. More power to you. Next is infectious disease, and they mention infection and Lyme disease under the National Fibromyalgia Association. And again, God bless the people that figure out that they've had Lyme disease and get treated for it and improve. One of the things I thought that was absent for their list was HIV/AIDS, and this can cause problems with muscle weakness, fatigue, etc. Psychological and psychiatric disorders. They mention anxiety disorders, cognitive dysfunction. And again, that could be caused by an underlying endocrine condition. We'll get into that more in a bit. But by itself, I suppose it could happen like with depression, for example, that they do list. And they have hyperventilation, which sounds like an anxiety disorder. And I did add post-traumatic stress disorder to the list. I'm going to speak from my opinion. I think something like that could be a problem unto itself, or it's an event, a stressful event that could unmask an underlying condition. Another thing absent, I thought, from their list were cancers of all kinds, and that can cause fatigue, muscle wasting, pain, etc. Although they do list chronic tender swollen lymph nodes. And, is that a cancer causing it, or is it an infectious disease? Again, I would urge people to turn over every rock to try to find out what's going on if you were to have those type of. Okay, neurological, neuromuscular conditions. Carpal tunnel syndrome probably would have been better under orthopedic because that's who generally fixes it. I suppose a neurosurgeon could, I'm not sure. But anyway, that's when a nerve becomes constricted and the hands go numb. And that could be from repetitive motion. Myofascial pain syndrome, we already touched on that. Just a little bit of a side note that it did turn up in a study alongside fibromyalgia, and it's not one and the same, separate conditions. Fibromyalgia could have it, but myofascial pain syndrome could be completely separate. I also included multiple sclerosis and Lou Gehrig's disease because of the muscle weakness that it can cause. While we're on the subject of neuromuscular disorders, it's a good time to bring up endocrine myopathies. And this is a muscle disorder. Myo is muscle and pathy is disease, or something wrong with it. And people can experience muscle weakness, pain, cramps, muscle tenderness, and spasm in various degrees. It could be caused by endocrine problems of the thyroid, parathyroid, adrenal, and pituitary, ovaries and testes, and island of Langerhans of the pancreas. Um, and I bring this up. I actually went to a neuromuscular specialist and had an EMG, and a lab that they would take is called CK creatinine kinase, and that lab would show if you're having very rapid muscle breakdown. Um, the note of the EMG electromyography with Cushing's, the EMG is often normal, and mine was. My CK was as high as it could be and still be normal. Um, but I bring this up because of, to demonstrate there really is an issue between endocrine and muscle disorders. Um, Also, back to the EMG just for a moment. With Cushing's, that could be normal. I'm going by memory, but I believe it was thyroid conditions. You could have an abnormal EMG, but the point being they need to get down to it. And when I did do my homework too, when I went to see the neuromuscular specialist, I did learn that people with a history of Cushing's could actually have a protein loss in their muscles, which could be demonstrated through a muscle biopsy. I did not have that. But they show an actual reduction in the proteins, and it affects the type 2 muscles. All over my, all above my pay grade, but well worth mentioning at this point on this journey. Sometimes women will have gynecological conditions associated with fibromyalgia, dysmenorrhea, and I underline ovarian cyst because that could be PCOS, polycystic ovarian syndrome, and that could be confused with Cushing's syndrome and metabolic syndrome. So heads up on that one. Endometriosis, female urethral syndrome, and they do mention interstitial cystitis, and the latter could be associated with men also, and premenstrual syndrome, and boy, that could happen to anybody. Next, we're on to gastroenterology. And this first one really struck a chord with me, and it's esophageal dysmotility. When the motility of the esophagus is slowed down or not working correctly, like the musculature is not working. And what really struck a chord with me, it didn't happen overnight, but as I was progressively getting more ill with hypopituitarism, this did happen. I mean, swallowing a bite of chewed up banana felt like a lump going down. And in the meantime, it affected my whole GI tract, where things were moving at a pace of a slug, to where my appetite was gone. I wasn't eating hardly anything, but yet not losing weight. And then, I don't mean to be gross, but then vomiting set in, and and then you're really not eating anything at all. Okay, enough said on that, but that was associated with hypopituitarism. And next on the list we're from the National Fibromyalgia Association, and they're the same thing. Functional bowel disorder syndrome and irritable bowel syndrome have the exact same definition, and that includes cramping, abdominal pain, bloating, gas, diarrhea, or constipation. And they try to treat the symptoms, and it cannot be cured. again, turn over all the rocks. That's all I could say about that. And then here again is the interstitial cystitis. This is male or female, and it causes painful urination, pain in the pelvic region, and frequent urination. And I'm not sure if there's any connection with endocrine disorders with.